You can start, sir.
Okay. Good evening, doctors. Students, welcome once again for the 90-day University Prof Pre-Final Mastery in Auricle. So now we have reached a systemic bacteriology sixth topic. Okay, one of again important topic and easy topics only. So once again, no need to say, you already know that we are doing all the rapid revision of all important questions, volatile fact, quick revision, high yield topic revision, and most expected topics is covered here in this 90-day University Prof Pre-Final exam. Okay, not only for Prof exam, it's also for your NEET, PG, INICT, FMJ, everything. It's going to be useful for all the exams. Okay, so now we're going to move forward. Okay, now. So these are the topics we are going to cover in 90-day university. So long question today. The long question would be your the bacterial zoonotic disease. Yeah, we're going to list the zoonotic disease. Yes. So these are the things we are going to discuss today. That is the zoonotic disease one, and the other one is your, in short essays, you're going to talk about Acinetobacter, Yersinia pestis, your stalachatism, pathogenesis of plague, and then the morphology and the cultural characteristic of Yersinia pestis. These are the topics we are going to cover, right? So now, yeah. So no need to know, you already know everything about our recorded classes, live classes, yeah, and then the practical session, and then your exam module and hard copy sets we have. If these are things available in our Auricle, you know that one. Recorded classes, it's very good for flexible learning. Another thing, live classes sessions which you are having like now for in-depth coverage, experienced educators in interactive learning will be happening here. And you know that express exam module, that means all your complete syllabus in 20 hours, and then answer writing skills expert educators will help you out. One-to-one clearing session also, doubt clearing session also will be very, very efficient and effective, useful for you people. Yes, and then also hard copy sets will be provided for you so that you can add additional notes, and for last moment revision it's going to be very, very useful. So you will be having this also, you'll be getting it. And then this one, so the question banks are available. You'll get a very good amount of questions in this question bank that is sufficient enough for you to clear your exams very easily. And practical sessions also will be included, and we will teach you that also. And so these are the plans we have. Our subscription plans are, we have different type of plans: foundation, advanced learning, complete learning, ultimate MBBS plans. These are the things we have. So you can choose whatever is suitable for you, and you can use this code Dr. Santhosh Rajan 20, my name, and then for a discount. Okay, so that's all. So now we'll start our topic. Okay, so first thing here, the question is like, what are the zoonotic diseases, and give what are the zoonotic diseases. Give examples about epidemiology laboratory, any one of the bacterial zoonotic disease they have told. Okay, so first of all, let's list out what are the zoonotic diseases. So for that, yeah, zoonotic disease. What are zoonotic diseases? Zoonotic diseases are basically the diseases which is transmitted by the diseases which is transmitted from animal to human. From animal to human. These are the zoonotic diseases. Zoonotic disease, if you want to give an example, you can give any example. Zoonotic disease can be bacterial caused by a bacteria, or it could be viruses, or it could be parasites. You know, a lot of parasites are coming from animals only. And then, of course, it could be some of your fungi. Mycology is also possible. Okay. So, most important things you should remember, because you always expect a question from the zoonotic topic. Yeah. So, in bacteria, you know that one is your anthrax, Bacillus anthrax. You know the animal skin. We already spoke about it, anthrax. And plague. Plague is the one topic which we are going to cover now. A lot of diseases are going to come from plague. And the other one is tularemia. Okay, tularemia, another disease. Okay, and pastorella from the cattle's, all these things. These are the very, very common ones. We have other things, and of course, don't forget the brucella, even your leptospira, which we already covered. Leptospira from the rat, if you remember. Brucella from the cattle or anything, any cow's milk, all those things. So these are the diseases which are bacteria. Rabies easily, in viruses, you can easily say one disease, that is your rabies. Which rabies is usually transmitted from the, and not only that, from dog bite, and Coisinor forest disease, if you remember, that is coming from the monkeys. Even chikungunya, these are some classic diseases. Okay, rabies, KFT, chikungunya, even your yellow fever, Japanese encephalitis. These all have link with the animals. Okay, so some of the viruses, parasites, n number of we can say. Example, if you started from the starting only, if you see Ascaris, your hydatid cyst, that is dog. If you remember, hydatid disease, that is basically echinococcosis, toxoplasma, cat, right? Cat. Ascaris could be anyone. And of course, your Taenia, Solium, Taenia, Saginata, they're animals only, right? And your Trichinella also, if you remember, pork. Trichinella, Solium, chicken, Taenia, anything, but in Trichinella. Also Trichinella. Okay, Trichinella spiralis, that is affecting the muscle. That's also one of the thing. Okay, parasites. In fungi, the classic one is your Cryptococcus. If you remember, Cryptococcus neoform is coming from the bat. But not only that, many things. If you remember, penicillium, it's coming from the bamboo rat, right? That is one cause. Not only that, all your dermatophytes usually come from the pet animals. The dermatophyte infections, ringworm infections and all, they come from there. Okay, so big list. Not only that, many of the dimorphic histoplasma, example, histoblasto, they all have link with the animals contact. So these are very common zoonotic diseases, So one classic example, they told write about any one vector zone. So usually you get anthrax to discuss. So plague we will do today. Rest all not that much. Brucella we have another separate topic. So we'll do it there. So now plague is the good option. So we can discuss about the plague only. And we have questions on plague only. So let's see here. Okay. Now, yeah, if these are the things, everything explanation is given here, you can clearly see. Okay, plague, reservoir. So before that, let's. So they told to give example, no? So we will talk about Yersinia. So we're going to talk about today they have told about, give one example. So our example would be Yersinia pest. Plague. We'll talk about the plague. Plague is one of the zoonotic disease. So what are the things you should know? Everything is important here. First of all, you have to tell about the etiology, which is caused by what, and what is the usually what is the reservoir, and then how it is transmitted, okay, and then where all it, etiology, reservoir, transmitted, and then some of the virulence factor. We have to talk about all these things. First of all, etiology. Plague means itself, you should know it is transmitted by which one? Yersinia pestis. Yersinia pestis, okay. Reservoir or the rodents, especially domestic rats, they say, but it can be any rodents, wild rodents, okay? All the wild rodents. Transmitted by which one? Rat flea. It can be any flea, but usually the rat flea is the most common, followed by not only that, even rat flea bite is one thing, but also through contact. It is possible through contact, and also through droplet. It is possible to every ways. Okay, you can get. Okay, so these are the things common for plague, how it is transmitted by. Virulence factor, very, very important is virulence factor. Virulence factor, there is one important thing called F1 antigen. F1 antigen in the cell. This F1 antigen has a very important role. Means what does it do? This F1 antigen, it is actually inhibits the phagocytosis. It inhibits the phagocytosis. That is what this Yersinia pestis can work properly. So this is the main virulence factor. This is the main virulence factor, and it is also used for this diagnosis. It has a role in important role in serodiagnosis. Both the antigen and antibody of F1 is very important in the diagnosis part also. Okay, F1 antigen. Then apart from F1 antigen, we also know that there are other lot of enzymes, important enzymes, phospholipase, and a lot of additions, and siderophore. This is like ion capturing mechanism. So these are the other virulence factors. These are some important virulence factors for plague. They can ask you simply just pathogenesis also. You have to write all these things. Okay, fine. Now what happened? This thing. Now next we're going to the disease part, pathogenesis part. Okay, so yeah. Now pathogenesis part. When you go to the pathogenesis, you know that once when this Yersinia pestis enter into the body, so usually it affects three important, it can cause three types of your plague. So first one is your bubonic plague. Okay. Second one is your pulmonary. And third one would be your septicemic plague. This is your pathogenesis, also clinical feature of plague. Okay, plague clinical feature. So first one is the most common one. The most common bubonic plague is the most common type. It means what happened? It affects the lymph node. Bubon means like a lymph node. No, so lymph node is affected. It can be any lymph node, any local lymph node, usually inguinal, axillary, neck, doesn't matter. Any of the lymph node is usually affected. Plus, of course, patient will have fever and other symptoms. Yeah, this thing. And sometimes what happens, the lymph node can get eroded. Okay, it can get eroded, and then secondary infections are possible, whatever. Okay, but this is the most common type. So all the lymph, it could be any lymph node. You can see boob, that big boob that looks like a bobo. Okay, bobo. That means swelling of the lymph node. So this is the category of bubonic plague, most common type. This is a one mark question also they will ask you, which is the most common type. Okay. Now, next is pulmonary. Pulmonary is usually, this is through bubonic usually to the bite or anything. Pulmonary usually due to the respiratory route, yeah, transmission, due to transmission route. So here, usually it can have pneumonia-like symptoms. It can cause pneumonia-like symptoms. Okay, but if the plague is not treated early stage, then it can go to both your bubonic and this is due to the bite of the insect, okay, bite or contact. If this is not happening, if the treatment is not given earlier, then it can go to blood and cause septicemic plague. In septicemic plague, what happens is that usually they end up in septicemic plague. When they go to the blood, then in the blood, it then causes the blood vessel ruptures, and then there will be bleeding and all bleeding, and usually it ends in the gangrene. After bleeding, the local region, you will see the gangrene. Okay, so gangrene can be seen. So this is gangrene seen mainly in the periphery of your foot, fingers and toes, fingers and toes is very dangerous. Gangrene lesions you can see. That is what you call this as a black death. Plague is otherwise called black death. Okay, black death. So this is another important point, which is a black death. Your plague is a black death, especially septicemic. So which of the following is most dangerous? Septicemic is the most dangerous one. Okay, most common one. This is most dangerous one. Most dangerous plague is your septicemic plague, because your whole leg will, I'll show you the picture in a while, so get it. Okay, so this is a pattern clinical feature. You're going to say this only: bubonic, pulmonary. If it's a complication, if both bubonic and pulmonary if not treated early, then they become septicemic plague. So blood vessel bleeding, then ends up in the gangrene, and then peripheral foot and finger gets gangrenous, and that is called a black death. Okay, that's called black death. Okay, black fever is Kala Azar, you know that. So this can be also one more question they can ask you, right? Okay, now next is your lab diagnostic part. Now, when you talk about the lab diagnosis, hmm, okay. So in lab diagnosis, what are important? The first one is, so as usual, we are going to do the microscopy. Whenever you're talking about bacteria, you're going in this order only. Okay, microscopy, first one. So we talk about microscopy, two things. You can do either gram stain. Other one, there's a special stain that is an important question we call Wason stain. Wason stain, special stain using methylene blue we do for Yersinia pestis. So in gram stain, basically what you see is that you will be seeing the gram negative coccobacilli. Nothing much, right? But in Wason stain, you're going to see very important and frequently asked question. You see a bipolar, I'll show you the picture also, bipolar staining, or you call safety pin appearance. It means it looks like this. At the end, you have like this. Okay. So it is like a safety pin or bipolar, you call bipolar staining, safety pin appearance can be seen. That's it. This is in your microscopy, right? Now, next is your, so microscopy is done. Now, second one is your culture. In culture, what happens is that if you can grow in a normal blood agar, if you grow it, you can do it in a blood agar, or special media is you grow it in a ghee broth. You grow it in a ghee broth. Okay, some special things you can see. In blood, what you see in blood culture, what you see is that you will see no any special thing except in blood agar you see one thing, you see brownish pigment. Brownish pigment can be seen in the blood agar. In ghee broth, there is a growth called stalactite growth. We'll talk about it. Okay, I'll show you in a while. Stalactite growth can be seen. Okay, yes. Now, third one. Apart from these two, third one, serology. The third one is your serology. In serology, as we told just now, F1 has very important role. So this F1 antigen and also the antibody of this is detected by ELISA. Very simple. Do ELISA and you'll find it. Okay. The last is your PCR. You can do PCR also. That's all. These are the common things. Very, very important thing. Lab diagnosis of the plague. So very simple and easy. Easily you can score good marks in this topic. Okay. Now, so everything is given here. You can see all the examples of zoonotic disease, pest and the Yersinia pestis plague, all the things. There's one more thing I forgot is the Chiopsis index. You go to this Chiopsis index. Yeah, this is the one we want to say. This Chiopsis index. Chiopsis index is 1. If it is more than 1, it tells about the outbreak, because Chiopsis is basically this rat flea. Other name is Xenopsella chiopsis. That just want to remember that. Okay, that's it. Rest all same, only whatever we spoke. Bubonic pneumonia, black death, everything we have mentioned here. Now, yeah. So, yeah. So this is stalactite growth here picture, and look at this bipolar staining here. Okay, look at the bipolar staining. This one, this is the one I'm saying. You can see inside, if you zoom and see, it will look like this bipolar staining, invasion stain. That is characteristic. Stalactite growth is like this. We have a separate question. I'll come there. Okay. And this thing, that's all. So these are the things important in your Yersinia pestis. Okay. Yeah. Now, so we talked about it. Yersinia morphology, culture means, again, now you talk only about morphology means you're going to write about the bipolar staining. If I just write it here shortly here. It is a short, this is actually short notes now. So for short notes, if you get this question, you will be basically writing morphology, that is a bipolar staining appearance, bipolar or safety pin appearance you're going to write. And culture, you're going to write culture characteristic, same. I told you in blood agar, you will see the pigment. And in ghee broth, you see stalactite growth. That's all. Okay, this only just little bit elaborate and draw the picture how it looks for by safety appearance. You draw like this. And stalactite growth, I'll show you now in a while. So what does that stalactite growth means? Okay, we have separate question also for that. Okay, right. This much only. You want to write about this? Then yeah. This one. This is the question. So there are two important things, satellitism and stalactitism. Satellitism, we already spoke in H influenza. We are striking center, staph aureus. The growth will be bigger when it is close to staph aureus away. So it's like Haemophilus influenza. Now this one, stalactitism is basically, this is seen in, first of all, the first point, this is seen in Yersinia pestis. Short notes, it will come. You're going to say it's Yersinia. This can be 1 mark or it can be 5-mark question or anything, short notes they can ask. Seen in Yersinia pestis. What is the procedure? Procedure is basically, you have to, you're going to inoculate Yersinia pestis colony, that bacterial colony, whichever you isolate, and into which broth? Ghee broth. Yersinia pestis means ghee broth. So you put in a ghee broth. This is the ghee broth. What you're seeing, this is the ghee broth. Okay, you put it there and leave it inoculate, then incubate. Incubate it for whole night incubation you can do. Okay, and after incubation, then what happened? Next, if you see a growth called stalactite growth. So what is this stalactite growth means? This is growth, stalactite growth. When you say stalactite growth, you see in winter time, what happened in the ceilings of the house, whenever there's a snowfall, the morning, you can see the things just hanging, the ice is hanging like this. So same way you see here, this is the growth. You will see a growth just hanging like this. From here is your, this is your basically Yersinia pestis. This growth is called stalactite growth. So this is classical for your Yersinia pestis alone. That's it. Okay, this is stalactite. This much only you're going to write. You're going to write Yersinia pestis. Another one procedure, your two things you should know. One is your ghee broth. Other one is in the morning, you'll see a hanging, this stalactite growth, which is a hanging type of growth. Okay, hanging growth or stalactite growth, whatever. Okay, so you see this much. This is your stalactitism. This much only. Very, very simple and easy. Nothing to confuse here, right? Yeah. Now, next one. So pathogen of plague, we already spoke about it. Okay, so I'm going to write it, refer it from the previous question. Refer from first question. So in the first question itself, we've discussed. So again, it's repeated. So same thing. When you talk about pathogen, I'll write it also pathogenesis. All things you have to remember in pathogenesis. First of all, you have to talk about plague means you're going to say what? It's caused by Yersinia pestis. Then it is transmitted, the reservoirs or rodents, and it's transmitted by rat flea. Okay, this point, first point you want to write. Second one, you have to write about the virulence factor. When you talk about the virulence factor, you already told you, repeated, F1 antigen. This is the most important antigen, followed by other enzymes like phospholipase, adhesins, and even your siderophore. Okay, siderophore. These are few specific things. They are virulence factors. Okay. Now, after this, you're going to write about all the plague diseases. You're going to talk about all the plague diseases, plague, all different types of plagues you're going to write and mention it. That's it. This is the same thing. Pathogens of plague, same thing. Okay. So it's like a revision for us. Now, next question. Next question. Okay. So now we will go to Acinetobacter. The another very, very important topic, recently become very popular. This has become very, very popular, and definitely examiners are going to ask. This bacteria was quite silent. Last maybe more than 10 years, it was nothing. But last 2, 3 years, this is growing very much because, tell you why. First of all, Acinetobacter, the species name is Acinetobacter baumannii. This is the main thing. Okay, Acinetobacter baumannii. Now, this is etiology. First of all, the organism is the species name is Acinetobacter baumannii. Now, the next important thing you have to tell about the source. from where this is coming. Okay. Then about the virulence factor. Source and then go to the virulence. Why it is very, very virulence. Yeah. These are the two things. Then we'll go to the disease. So, first of all, source, it has become a very important source for environment. It is present in environment. Okay, it will be present everywhere. Soil, all the basically it was in soil and now it's everywhere. Okay, soil, air, everywhere it is present. Okay, now what happened? Important is hospital environment. In hospital environment, especially in ICU, so everywhere in ICU, especially in ICU, also in the wards, doesn't matter. ICU and wards, this has increased these days. Okay. Another important reason is it is because of poor hand hygiene. Poor hand hygiene by poor hand high. Okay. Now, last one is your lab diagnosis. Acinetobacter, how to diagnose the Acinetobacter. So, in talk about the lab diagnosis, first one, again, microscopy. In microscopy, you do only the gram stain. In gram stain, you will be seeing gram-negative coccobacilli. Then culture. Culture, no, there's no specific media. Either you do put in blood agar, you see, in blood agar, you see non-hemolytic colonies, you'll see non-hemolytic colonies. And in the blood agar. Then, of course, in your other McConkey, you will see NLF colonies. Non-lactose fermenters, yeah, non-lactose fermenters. Yes. And apart from that, when we talk about biochemicals, little bit biochemicals, we usually put this test called I cut. No, we call this I cut. So I cut is basically indole. Indole is usually negative here. C for citrate. Citrate will be positive. Urease will also be negative. In TSI media, triple sugar iron media, you will see K by K. That means alkaline, all will be pink color. Alkalines by alkaline, alkaline slant, and also alkaline bud. That's all. These are the lab tests for Acinetobacter. So Acinetobacter is usually 5 mark question, but they can ask you in a long question also. So whatever you told, if you write it, this is more than enough. Okay. So anyway, uh, I'll show you this explanations here. You can see everything's clearly mentioned here. Whatever bacteria, from where it is coming, pathogenesis, outer, what are the important proteins here, biofilm. Don't forget, biofilm is also another important point here. Okay, remember that. Yes. And then, yeah, clinical manifestation, all the diseases, yeah, catheter, COWT, everything I've told, VAP, everything, mainly hospital-acquired infections. That's all. And then important lab diagnosis. So I told you everything. I told you this much only. So this is for your Acinetobacter. Okay. So that's all for today's topic. So go through it. It could be for Acinetobacter will be a little bit new and confusing, but you have to know because this is a popular topic. Means definitely you're going to have these questions easily. They'll ask you in exam. Okay. That's all. So that's all for today. So thank you again. We finished. We came to end of a topic. Yeah, that's all for today. Sandeep?